Hey everyone, how you doing today? Hope it's going great for you. We've got some chill in the air finally. It's starting to feel like fall. I'm feeling like baking with pumpkin and cranberries and apples and all kinds of wonderful, yummy things like that. I just in a baking mood all of a sudden. So I posted a recipe on some of the Preparedness Pro pages as well as some of the other prepper pages for the pumpkin pancakes with pineapple. Oh, those are some amazing pancakes, I'm telling you. If you like a good, warm, harvest tasting pancake and you like that little spurring of flavor with the pineapple in there, oh, it's so good. Just regular maple syrup. Or you could make a pear syrup and pour that over it. Ooh, yummy. It'd be awesome. But anyway, okay, got myself in a food mood. Clearly, I do that often. All right, so let's talk about pharmaceuticals today. So, did you know that it is very, very rare for someone to reach the age of 80 and not to be on several pharmaceuticals? In fact, apparently the average number of pharmaceuticals for ages 70 and up is 6. Guess what? They do not have scientific research over the interaction between the pharmaceuticals once you hit number 5. Not exceed, but once you hit number 5. They don't have a clue what happens. So yeah, that's fun. So basically they have not a clue what's happening with our septuagenarians. Is that the right way? Septuagenarians? Yeah, I think that's the right one. Anyway, so what I wanted to talk about is I wanted to answer a question today as to that I get a lot, which is how long do medications actually last? So how long do my drugs last, or how long can I stockpile XYZ drug? And that's an understandable question. I found some research years ago that I went back to revisit today and discovered that research was primarily done for veterinarian medications, which are typically similar to human. For example, they gave my dog Benadryl not too many weeks ago, and the same antibiotic as I was given. They gave my dog. Just interesting things like that. I've seen common medications for the vet industry as for the human. So I thought that was interesting. And so I read that study with a lot of attention and a lot of note taking. And then I came across the FDA study called the SLEP, or SLEP, Shelf Life Extension Program. And basically what happened is back in the 80s, the GAO saw that we were tossing $9 million, and this is back in the 80s, $9 million in medications on a regular basis, on an annual basis for the military. And so the DOD and the FDA got together and did a study at the behest of the Air Force, actually. That's who initiated it, so that we weren't tossing all these medications. Now, it wasn't really that they cared about the taxpayer dollar, in my opinion, although I don't know, that was better leadership back then. But I think it was more that they were concerned about the logistics with the military and having to keep all these medications updated all the time. And they wanted to know just how far they could push it, which is important. I can imagine or I should say in a real crisis, on wartime, on the battlefield, doing medical work on the battlefield and saying, sorry, you can't use that blood product that expired yesterday. Or sorry, you can't use that drug that we have in stockpile to the gills, and we're not going to get anything new because we didn't notice it had expired yesterday. I can understand there'll be some logistical issues with that, and with that kind of making sure that our men and women in the military actually got premium, care while they were on the battlefield. So that makes sense to me now. I better understand why the DOD would get involved in a medication study. So anyway, that's what happened. So in 1986, the SLEP program was put in gear, And there were some very interesting statistics that came out of that. Now, you have to understand that that was put into play in 1986. We're benefiting greatly from that study today because so many years have passed since 1986. And the study results are quite interesting. They were updated as of 2017 with some interesting results that I think you'll be very happy to hear about, especially those of you who are concerned about, stockpiling some of your medications, getting them at today's prices instead of tomorrow's crazy prices and the next day and the next day. There was also a study in 2012 by a doctor out in California. We won't hold that against them. But this doctor did a study having discovered a pharmacy with medications that were decades old. And so they did a study on the efficacy of that. So we're going to get to all of that. One of the things I thought was interesting and that what really led me down this rabbit hole is because of all the pharmaceuticals in the water. And I was reading of what pharmaceuticals are present in the water, which tells me that they're pretty hardy if they can end up in the water like that and still be active and recognizable compounds. Some of those, I'm going to look at my notes here. Some of those were specifically antidepressants, hormones, antibiotics, and pain relievers, as well as anti-epileptic drugs. So that tells me, these are some of the common compounds that were most frequently detected in these particular pharmaceuticals. And that tells me that these are some pretty hardy drugs. And basically, the pharmaceutical industry creates their medications to be hardy and reliable, not too fragile, for that very reason, so that they can, deliver them in time and have them sit on a shelf at least reasonably long enough to be used in hospitals. So hospitals can stay stocked up on them, as well as medical facilities in the military. One thing that I noticed, though, that I thought you guys might be interested in hearing, well, maybe not interested. Maybe that's a little stretch. Maybe you don't want to hear this. But there's no federal regulations in the United States specifically limiting pharmaceutical concentrations in drinking water. Yeah, it's not against the law. It's not against any EPA regulations. There's none in the US whatsoever. So if you wonder why you're feeling a little wonky lately, maybe there was just a little too much Xanax in your water, or Ambien, or something like that. All the more reason for us to have water filtration in our homes, even now. Like I said, the crises, it's already here. It's just one more of those crises that are already here that we need to have a counter move for. So I thought you might find that interesting. Okay, moving along here. Let's talk about this. So basically, I figured that with it's almost $580 billion being spent annually. And that was in 2021. That was the latest figure I could get. And that figure just continues to grow steadily over the years due to factors like your rising drug prices, an aging population, which taps into that, and the introduction of new and often more expensive medications. The newer they are, the more expensive they are, because they're the only one out there. And so they can be as expensive as they want to be until a generic comes along. So because of that, I thought that this was an appropriate topic. And the fact that preparedness-minded Americans are struggling to be ready should there be an interruption in their medications due to a natural or other type of widespread disaster, I figured that this was appropriate. So I wrote a blog on it today. There are more details in the blog than what I'm going to provide you here. And there's also more here than I'm going to provide you than what's in the blog. So if you want to read the blog article as well, it's posted today on preparednesspro.com. But basically, pharmaceuticals are produced to be long-lasting and durable. And from an environmental perspective, the long durability of a pharmaceutical product is a problem since it doesn't break down. And instead, it's accumulated in the nature and the residue of everything found in the environment for huge periods of time. So I'm thinking, if it can stay in the environment for huge periods of time, then why can't it stay on my shelf? Why do I get these paranoid people telling me, oh my gosh, you got to throw that out? That's dangerous. So we'll talk about that too, because the FDA apparently doesn't agree with them. So that's interesting. So it stands to reason that active ingredients in pharmaceuticals are effective well past their expiration dates that are assigned to them. And we're going to prove just that today. Let's set some baselines though. A drug product is considered unstable when the drug substance, your active ingredient, loses sufficient potency to adversely affect the safety or the efficacy of the drug, or falls outside of the labeled specifications, okay? Also, just so you know, it's considered a viable drug as long as 90% of the labeled potency is acceptable. As long as it still has a 90% potency level, then that's considered acceptable. So keep that in mind with this study. Also, let's talk about the expiration date. The expiration date is the final day that the manufacturer guarantees the full potency and safety of a medication. There are no requirements on how long an expiration date has to be, or could be, or I should say how short an expiration date could be. So follow the money. The shorter their expiration date, the more money that the pharmaceutical industry makes. So apparently we are believed, based on this SLEP study, we are believed to be throwing away nearly $1 billion in medications just in the military alone, based on the expiration dates that the pharmaceutical industry has given. So imagine what it's like on a national basis, because people have been scared to death of expiration dates with medication. So drug expiration dates exist on most medication labels, including prescription and over-the-counter and dietary herbal supplements. Now, the expiration date of a pharmaceutical is usually set between 2 and 5 years. Remember that number, 2 and 5 years. Finding something that has an expiration date that's set for longer periods than 5 years are very uncommon. I can't find one yet where it has an expiration date beyond 5 years. So that tells you what the tolerance level is at the pharmaceutical industry. They don't want anything that's going to be sitting on the shelves that long, because then you don't buy them again and again and again. And now I feel sick to my stomach for all of the over-the-counter pain relievers that I threw out when my mom passed away. They would still be good. Well, actually, now they probably wouldn't be good. No, they'd still be good. And that would be nice to have in a crisis situation. Just a little tidbit here to share with you. One of the medical doctors, I have a very, my mom went into the hospital because she broke her arm, and she's 83 now. And it's the first time she's been in the hospital in over 40 years. And she wasn't on any medication, shocked the doctor that she wasn't, but she wouldn't take anything for the pain either. And so he thought that meant anything prescribed. And so he kind of gave her a wink, and he said, okay, I'm going to tell you a little special formula. You take a combination of ibuprofen and acetaminophen, which apparently now they have in Sam's Club, which is kind of cool. And it will be as effective as an actual pain medication. So if you can't get your hands on the real stuff for a crisis, as long as you have ibuprofen and acetaminophen, you're still sitting pretty. So just a little FYI here, but you'll learn a little something on these pop-ins. Okay, so remember that 2 to 5 years. So the expiration date is part of some approval procedure that the pharmaceutical companies conduct, and it's based on their documentation of stability studies that they create. So it's not influenced upon them. It's not thrust upon them. It's not a guideline that they're given. They can make the data look however they want it to look, is what I'm trying to get at here. The producer needs to provide an expiration date that is required, and to specify how the pharmaceutical should be stored. That's required. But there's currently no regulation on how long a pharmaceutical product should last. And that's interesting. I think that if they're going to charge us an arm and a leg, that maybe they should not scare us into thinking that they can't be used afterward. So the United States Center for Drug Evaluation and Research officially recommends that drugs past their expiration date should be disposed of. Now, like I said, the Department of Defense wasn't really willing to take that any longer. And the DOD, along with the FDA, were scratching their heads and going, there's got to be a better way for us to do this. And it was really a logistical issue. It wasn't a monetary issue. They figure that they have carte blanche checks to write with Americans' pocketbooks. So, but it's been argued that this practice is wasteful, of course. And since consumers and medical facilities are encouraged to purchase fresh medication to replace their expired products, it's obviously resulting in additional profits for pharmaceutical firms. So now you have medical authorities, though, lots of them, as I found out today. Well, not just today. It took me a while, but today was the crux of my research, which is why I got my blog article out late. Medical authorities state that expired medicine is safe to take, even those that expired years ago. Its true effectiveness of a drug may decrease over time, but much of the original potency still remains even a decade after the expiration date. You can get that from a lot of doctors. That's without the study. A decade past the expiration date. However, there are some exclusions to that. Nitroglycerin, nope. Insulin, nope. Liquid antibiotics. Most medications are as long-lasting as the ones tested by the military, but when you get into outside of the capsules and the tablets, then you're in a whole other neighborhood, if I dare say, and you just can't expect those kind of expiration dates. So, but placing a medication in a cool place, such as a refrigerator, will help the drug remain potent for many years. However, guess what the requirement was for this test? 77 to 85.6 degrees. 85.6. I know it was a 0.6, but it was 77. Oh, 77 to 98.6. That all the samples should be stored at a temperature of 77 to 98.6. So that means don't keep it in your car, folks. Some instances, higher or lower temperatures may be required for good efficacy, but that was their barometer in their test. So, okay, let's look at the forms. Solid dosage forms, your tablets, your capsules, those appear to have been the most stable past their expiration dates. Drugs that exist in a solution or as a reconstituted suspension or that require refrigeration, like amoxicillin suspension, they're not going to have that required potency if used when outdated. And loss of potency, especially on an antibiotic, can be a major health concern when you're treating an infection, because in addition, you've got antibiotic resistance that can occur with subpotent medications because you're just dripping a little bit of it into your system, and you're giving your system the tools by which it can become drug resistant. So drugs that exist in solution, especially injectable drugs, should be discarded if the product forms a precipitant or looks cloudy or discolored or anything of that nature. Okay? All right, so each year we've got drugs from stockpiles that are selected based upon their value and their pending expiration, and they're analyzed in batches to determine whether their end dates could be safely extended. Now, that's part of this SLEP study. And the experience was found that the real shelf life of many of the drugs is well beyond the expiration date. So when I give you months here, I'm talking beyond the posted expiration date. So if you have a vitamin C that says expires 2026, know that you've got months beyond 2026. And this is one interesting thing. No one, not one person in the study, and that's since 1986, no one has been harmed by any expired drugs in the study after use. No one. Pretty impressive, huh? Tells you a little something, doesn't it? It's recommended that in order to study the stability profile of those active ingredients, we've got to stay in that 77 to 98.6 degree though, okay? All right. That the vet study was very specific about the higher temperatures, but the SLEP study liked to keep things between 77 and 79 degrees, whereas the vet study is the one that went up to 98.6 or 98, yeah, 98.6. Okay, so here's what the SLEP study, you try to say it, SLEP study data showed 88% of over 122 different drugs could have their expiration dates extended by at least 1 year. You're like, 1 year. With an average extension of 66 months. Now, this is the SLEP study I'm talking about. We're going to talk about another study. So 66 months is how many years? Okay. So you're looking 2 to 5 years beyond the expiration date. Now, it gets better though. Just remember that your drugs in liquid forms, not as stable. Like the bioavailability of the EpiPen, they were introduced during the study and were reduced when administered between months 1 to 90 after the labeled expiration date compared to those that were not yet expired. So even an EpiPen is not going to, I mean, they still went as much as 90 months after, and it wasn't as effective, but that gives you some effectability. But it does decrease after even month 1. So just FYI, I think EpiPens are important to have on hand. Just like Narcan. Okay. So many drugs retained their 90% of their potency. So remember what I told you earlier on is that 90% potency, that's your target. You want at least 90% potency. Some of them maintained even 10 years after the expiration date. Many pharmaceuticals retained a significant amount of their original potency. In fact, in the second study I'm going to share with you, it still had 110% of its active ingredient found. SLEP found that 88% of those 122 different drugs, though, were that average of between 66 and 278 months. Okay? All right, now let's talk about some certain medications that have a narrow therapeutic index. Little decreases in pharmacological activity, those can result in some consequences for patients. If it's a monoclonal antibody, that should be included in that group. That should not be used past the expiration date. So monoclonal is used for rejection drugs. You like your kidney, when you had a kidney transplant, you don't want the rejection drugs to go bad. So those would be monoclonal antibiotics. So you wouldn't want to use those past the expiration date. And guys, I hate to say this, but if you're type 1 or if you are a kidney transplant and there is a serious crisis, then you're not going to be around very long. That's all there is to it. It's just, you're just going to want to help other people get prepared as much as possible and leave a legacy of preparedness, but still focus on your first and second principles of preparedness, because those are still most important: your spiritual preparedness and your mental preparedness. Thanks for that question. I appreciate that. I guess I can't be all fun and games. Sometimes we have to talk about the obvious. Like if you're on insulin and you can't get off of it by change in diet and exercise and other options, which we could talk about, because I got off of all my diabetes medication. I'm no longer diabetic. We could talk about that on the side, and I can tell you what worked for me, and maybe you could have that benefit as well. Okay, so 90% of more than 100 drugs in this other studies, both prescription and over-the-counter, were perfectly good to use even after 15 years of the expiration date. So what does an expiration date mean? So proper storage of medications, obviously, and that potency effective date. Okay, let's talk about storage for a second, because the bathroom medicine cabinet, that is not an ideal place to store your medications due to the heat and humidity and the changes in the temperature. Obviously, medications should not be left in the hot car. Medications should remain in stable, cool, dry spaces away from the light. I keep mine in a bedroom drawer. I don't keep it near where all the hot steam comes from the shower. That just doesn't make sense to me. Humidity is not your medication's friend. The update on August 13th, 2017, turns out that the expiration date on a drug does stand for something, but probably not what you thought it did. Since a law was passed in 1979, drug manufacturers are required to stamp an expiration date on their products, like I said to you otherwise. But this date really only represents where the manufacturer is willing to guarantee full potency and safety of the drug, which I don't think it really cares, since most drug manufacturers are given a get-out-of-jail-free card if anything goes wrong with their drug. But still, that's the date which they have to post. That's a legal date for them. In other words, it's contrived by their science, but more so by their attorneys, because they have to guarantee that that's the full potency and safety of the drug. Now, with the USDA, the US FDA, with those 122 drugs, and some of them were OTC drugs too. 90% were safe and effective as long as 15 years past their original expiration date. So they had a grouping of them that were beyond that 278 months. Lowell Davis was the expiration date chief on the study, and he said that with a handful of exception, notably nitroglycerin, insulin, and liquid antibiotic, most drugs are probably as durable as the agency tested, which was 15 years. So we've got more than 15 years under our belt. And what's happened is, because the pharmaceutical industry was not willing to test their own drugs themselves, the FDA set up this SLEP program so that the pharmaceutical industry can turn drugs into the FDA and have the FDA test them in their SLEP program. So they've tested a range of drugs, including doxycycline, nerve agent antidotes, potassium iodide, flu antivirals like Tamiflu and Relenza, COVID-19 vaccines, and antibody therapeutics. I'm not going to try to say any of those names. Vaccines, primarily focusing on medications with military significance. So limited commercial use, perhaps, but you think about what they need in the military, the same kind of things that we're getting dosed out here, just perhaps in a larger purchase quantities like Cipro and doxycycline. So just FYI. So there's not a list available to civilians as to which drugs were tested. I came across very few studies that actually stated which drugs were tested specifically. The ones that I've mentioned to you are the ones that I've found. One thing, though, that I did want to bring up is that there was a specific study in there on potassium iodide. And to date, the only observed changes during stability testing have been a failure of some batches that were slower on their efficacy. They were about 75% in 15 minutes instead of faster than they should have been. Some tablets tested required slightly longer than the specified time to achieve dissolution, but even in the case of a failure, the product would still remain usable. So put that in your pipe and smoke it. No, don't smoke. It's not good for you. All right. In that case, what you could do is, if you had older potassium iodide, you could actually crush the tablets and mix them in with a juice or a liquid prior to administration and use that for emergency pediatric dosing if you had to. And any long-term stability evaluation, appearance should be monitored on your potassium iodide, because if you get this yellowish discoloration, that would be indicative of some stability problems. And so a lot of these are going to depend on packaging. So they did over 3,500 batches of these 122 drugs, and that had varied packaging. So overall, the pharmaceutical industry is packaging their drugs well for ultimate shelf life. Don't tell them that. K1 is known to be very stable as long as it's protected from moist air. It does not like moist air. Each batch is probably, they didn't feel like they needed to evaluate each batch. They thought that was unnecessary as long as the market package remains intact and continues to be stored under controlled conditions. That was the result of the test. So there you have it. So now your potassium iodide, not iodine, potassium iodide is safe and sound. So let's talk about this other study. I want to get to that. Here we go. So this study was, I'm sorry, I told you it was 3,500 lots. They did 3,005 lots. Want to get my facts straight. Sorry about that. Okay, so this study was done in 2012 by Dr. Cantrell for the California Poison Control System of San Diego Division of the University of California, San Francisco School of Pharmacy. So in that study, there were 8 long expired medications with 15 different active ingredients that were discovered in a retail pharmacy, and they were in their original unopened containers. And all of them had expired 28 to 40 years prior to analysis. So they had expired, not that, so not, don't count the 2 to 5 years that they had on top of that expiration date. So 3 tablets or capsules of each medication were analyzed, with each sample tested 3 times for each labeled active ingredient. So that tells you a little bit about their standard. 12 of the 14 compounds that were tested, which is 86%, were present in concentrations of at least 90%. There's that 90% number for you again, which is that's your generally recognized minimal acceptable potency. 3 of these compounds were present at greater than 110% of the labeled content. 2 compounds, aspirin and amphetamine, were present in amounts of less than 90%. So aspirin is apparently a little bit more volatile. It can't handle 40 years, folks. It was a little bit more volatile than your acetaminophen or ibuprofen. 1 compound was present at greater than 90% of labeled amounts with one medication tested, but less than 90% in another medication that contained that drug. So apparently this particular compound, it's phenacetin. If you have that in your medications, you can take a look. Phenacetin, Phenacetin. That's a little bit more volatile. So the U.S. Food and Drug Administration permits reasonable variation. So that 90 to 110% of the active ingredient claimed on the label, it's perfectly acceptable. 3 drugs found with less than 90% of their label potency were the amphetamine and aspirin and the phenacetin. Aspirin's known to degrade in vitro, but there are no such published data regarding the amphetamine. So be aware of that. You're going to have to find something else for your focus or for your weight loss or what have you. Aside from aspirin, all of the drugs like butalbital, aspirin, caffeine, and codeine phosphate had almost 100% of labeled concentrations. Now, I thought that was interesting because since the codeine measured in one of the drugs was also lower in another one of the drugs, between that 90 versus 99%, it suggests that the packaging was less intact and allowed moisture to penetrate. It wasn't about the drug itself, which I thought was interesting. So a decrease in the potency of that active component, it could result in an increase in the impurity. But what I found was interesting when I was reading this study is how codeine was able to stay effective at that 90% efficacy or better. So if you guys are getting pain medications that you're not taking and you want to have them on hand for your medical kits, by all means. 28 to 40 years on that study. 28 to 40 years. Again, that study does not tell us which of the drugs. It just tells us that they were common medications. So aspirin being one of those should tell you something. I gather from something else that was said in the article, or in the study, I should say, was that acetaminophen and ibuprofen were there as well. So that tells us a lot. It tells us that we have hope. We don't have to listen to the entity that says we should discard everything. Who are they again? I'm just kidding. Who are they again? Who's the United States Center for Drug Evaluation and Research? I don't know who they are. Anyway, so hopefully that helps you with some of your preparedness efforts. And let's just double check, make sure we don't have any questions. And we do not. We're good. I answered all those. Okay, so hopefully this will help. And I will see you next time. Take care. Bye-bye.